One of the things that's really impressive about residency here is that it's this really special mix of really smart, really laid back, and really kind.
One of the main focuses of the internal medicine program is first and foremost providing really top-notch clinical care to our patient population.
Having the different training sites throughout LA, there are 4 of them, and they're very different from each other. And I think each one lends a very different perspective and a different patient population to the richness of our education.
The variety of our clinical exposure is almost unparalleled. And so for me personally, it's been incredibly formative as I think about myself, both as a future practicing internist and as a researcher committed to doing research on health and inequality, to be able to see patients and healthcare systems of a great variety.
LA being such a large metropolitan area with so many different types of people, being able to go around to different sites really gives that opportunity to see them and take care of them.
So coming from New York, where it's an extremely dense population, I was nervous coming to LA because of how spread out it is. And I was specifically nervous about finding my community here. But in quick time after moving here, and really specifically because of the residency and the types of people I met and the family I very quickly sort of grounded myself with, I found myself not really missing New York at all, much to the chagrin of my family. And to this day, I feel like I have my people here, and I can say that with a lot of gusto.
What I was least expecting and was most blown away by both on my interview day and since coming here as a resident is just how much we're a very large group of people who look out for each other, who think together, who learn together, and who are always helping each other out, whether it's for emergency childcare or who wants to go to the beach together this Saturday.
I think one of the biggest highlights was how much of an impact I feel like our residents have and the voice that we have. You know, my first year when, according to kind of resident feedback, we ended up restructuring a few of our rotations, which was in a way surprising to me that, you know, really the administration took our feedback right away and were able to kind of make changes that would make our work life a little bit easier.
I didn't realize that it was possible to be so kind and compassionate and supportive without risking excellence. And I think UCLA does an amazing job of combining those 2 things without risking either one.
The faculty and attendings here at UCLA are understated. There are so many times that I am in a workroom and then realize that the attending I'm learning from is one of the world leaders in that field of research.
Everyone feels approachable, and that means a lot to me because one of the things that I think is important when you train at an institution is the access that you have to the incredible people.
Seeing people this important, listening to all of their residents and ancillary staff really shows us how kind of medicine should be conducted and how we should be acting as professionals within the hospital.
It's rare to be in a place where I feel myself every day being not only a better doctor, but also a better person.
Our patients are great, our staff is great, our residents are great, everyone's great. I have a great time here and really wouldn't change it.
You see yourself.
You see yourself.
You see yourself healing the world.
You see yourself here.
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 UCLA
UCLA Internal Medicine.